Hello everybody. In this video, we are going to learn how to memorize the classifications of vasculitis. Firstly, what is vasculitis? Vasculitis is a condition where the blood vessels of the individual get inflamed. Vascu, which means the blood vessels, and itis, which refers to inflammation. Now, vasculitis can be classified based on the size of the blood vessel being inflamed. So, we can have large vessel vasculitis, medium vessel vasculitis, and small vessel vasculitis. Now, the trick to memorizing these classifications can be with an analogy of a family. Large vessel is the father, the medium vessel is the mother, and the small vessel are the children of the family. The father loves drinking tea. Hence, both the conditions of the large vessel vasculitis will start with the letter T. The first one is temporal arteritis. The second one is Takayasu arteritis. Now, for a father, his favorite members of the family are his two girls, his wife and his daughter. Hence, temporal arteritis is common in wives. Now, by the sentence that it's common in wives, it does not mean it happens more in wives. Wives is just meaning that it commonly happens in females who are adults. Whereas Takayasu is common in daughters, which means it's common in teenage and young girls. Next, we go to medium vessel vasculitis. Now, medium vessel is the mother. So, here we have a story wherein the mother is running with a pan in her hand to hit her small 3 to 4-year-old child who is sitting on his dad's new Kawasaki bike. Now, what does the story signify? First, that the mother is running with a pan in her hand signifies pan, which is polyarteritis nodosa. And the second condition is a small 3 to 4-year-old baby boy who is sitting on his father's newly bought Kawasaki bike. So, the second condition is Kawasaki. Now, why did I mention that a small 3 to 4-year-old baby boy is sitting on his father's Kawasaki bike? That's because Kawasaki disease commonly occurs in small kids who are under the age of 5 and who are boys. So, it predominantly occurs in male who are under 5 years old. Now, the characteristics of this child. The child has red extremities. Second is that he is not worn any clothes since he is small, and hence we can see the area around his anus which looks red. So, red perianal area, which is perianal erythema. Third is that he is eating a strawberry, which signifies he has a strawberry tongue. Finally, we go to the last member of the family, which is the child. Now, these are the small vessels. Now, children can be classified as good children and bad children. Good children are ANCA positive, while the bad children are ANCA negative. We can further classify ANCA positive as C ANCA and P ANCA. Now, C sounds like S, hence C is the sister. Whereas P, if you flip the P, it becomes a B. Hence, P ANCA is the brother. Here in this story, the sister is the elder child, whereas the brother is the younger child. The sister is very modern. She's always recording reels, always on social media, always glued to her phone. So the sister has a tagline called we are Gen Z or we are the Jenners. So we Jenners, Wegener's disease is C ANCA positive. Now the brother is the younger child, as I mentioned, hence he is microscopic. And since we flipped the P to make it a B, therefore we have to give P its importance, its respect. Hence, we start the name with a P. Therefore, microscopic polyangiitis. Now we all know younger brothers are sort of weird. So they can do weird things like chugging sauce off a bottle. Hence, chugging sauce or chug straws syndrome is P ANCA positive. Next, ANCA negative. Now, ANCA negative has its own story. Here, the story of ANCA negative is hypersensitive high school students cry wherever they go in the globe because their bracelet gets stolen again and again. I repeat the story. Hypersensitive high school students cry wherever they go in the globe because their bracelet gets stolen again and again. This means ANCA negative hypersensitive is hypersensitivity vasculitis. High school students, which is Henox colon purpura, cry wherever they go in the globe, which is cryoglobulinemia, because their bracelet is Behçet's disease, gets stolen over and over again. Over and over again, an act that happens again and again is relapsing, and it's happening more than once, so it's poly. So relapsing polychondritis. So this is the whole classification of vasculitis. I hope this trick was helpful in memorizing this concept. That's all we have for today. Thank you.